Joined now by Nikki Patel. She is chair of the Young Dentists Association as part of the British Dental Association. Thank you very much, Nikki, for coming along. You've been a dentist for about 10 years now and you're working in NHS dentistry. Looking at your contemporaries you graduated with, how many of them are doing that and how many have gone into private work?
I mean, I couldn't give you an exact figure, but
in general terms.
But young dentists in general are the future of the profession, and the future of NHS dentistry relies on young dentists. And currently the morale of young dentists is absolutely rock bottom, and that is because of a contract which is target driven and which incentivises targets over actually providing the patient care and giving patients the time that they need.
What do you mean by target driven? Explain that for us.
So NHS dentistry is divided into contracts across the country. So a particular practice would have a contract that they would need to deliver. So there are instances with dentists across the country where they have to say no to patients sometimes because they don't have any budget left in order to be able to deliver NHS services to them.
Yes, one of your colleagues I spoke to earlier today talked about funding, talked about whoever is next in government re-examining the contract for dentists. So essentially, would you say there aren't enough dentists coming through to work in the NHS to care for the patients who obviously all require dental treatment?
It's not that there isn't enough dentists in this country. What it is that we need more dentists who want to work in the NHS. And because of the target-driven culture in the NHS and the underfunding that the service actually receives, it becomes very difficult sometimes for some dentists to work within the NHS within those
It's putting them off. It's putting them
Absolutely.
off. Now, looking at those figures, 2 million people assume this is in England. They can't get care where they live. Even if they were to explore whether care was available, looking at the figures we have, an estimated 1.45 million have tried and failed to get an NHS appointment in the last 2 years. Those figures seem to suggest that they might have trouble getting that appointment.
And absolutely, and actually that figure is probably closer to 4 million if you add it all up together, which is about 1 in 10 of the adult population who can't either get an appointment with an NHS dentist, the charges are putting them off, or they simply have just given up trying.
In a line, are you worried about future dental health because of all of this?
Well, absolutely, because the current contract does not incentivise prevention as well. So the more people that we can get to go to NHS dental services, the more that we can deliver preventative advice as well as deliver the treatment.
OK, Nikki Patel from the British Dental Association, thank you very much.
Thank you.